I'm one of the clinical leads for sustainability across NHS London and moving up to the Greener NHS team in a couple of weeks. I wanted to come and talk to you about a little bit generically about the work that we're doing across London, but specifically around the anaesthetic gases reduction project. And there's a couple of reasons for this, but just by way of introduction, sustainability in NHS London has been going for just about a year now. It was established during the COVID pandemic for very good reasons, and has hope. And we've managed to make some early successes. What we see is we were one of the first sustainability teams for a regional healthcare system, covering several ICSs, as you know, and using that and some of our work that we've had early successes through COVID in the last 12 to 18 months as exemplars for the rest of the country. What we very much want to do is to embed our work within the day-to-day practices. We've heard a lot, every time you hear about a business case or a new product, you'll hear about how much money they save or how much patient time they save, how many outcomes and quality of life improvements can be achieved. Even dare I say it, a little nod to equality and diversity and not leaving people behind with digital solutions. But nobody talks about the carbon footprint. And what we want to do is to embed that into everyday lexicon and make sure that people understand the impact and gauge the impact of what they're doing. And every new business case, every new proposal, every new project, every new pathway that's proposed should have that, not necessarily detailed assessment, but at least a consideration of the impact. And more often than not, we hope we'll find that new ways of doing things by definition are leaner, and therefore can contribute to the reduction in carbon footprint. For those of you that don't know, I'm hoping you all do, but the NHS has established a plan to achieve net zero by 2040, and an 80% reduction by 2030. So ambitious but achievable plans. There's a document that's available called the Net Zero Plan, which outlines all of the data and the thinking and the concerns and the projects behind that. And the Greener NHS team was the Sustainable Development Unit, is now spearheading that movement across all sectors of healthcare in the UK, in England, at least in the UK. This is a really useful schematic. This pie chart shows the carbon footprint of the NHS, and you won't be probably surprised to learn that about a quarter of the carbon footprint is actually due to direct care through sort of business as usual. The vast majority of the carbon footprint of the NHS is through supply chain and the production of medicines and equipment. A considerable amount of it is through patient travel and personal travel of staff as well. So that's another significant part of the activity that we're doing across London. And some of you will have seen the media and the comms pieces that have been coming out around idling and clean air and staff and active travel staff and active travel to work schemes. But what we're focusing on here is this 5% chunk. So a significant amount of the day-to-day activity of the NHS, 5% of the overall, is solely due to the production and use of anaesthetic gases. In terms of timelines, what we're hoping to achieve, we've got these broad timelines. They were slightly pushed back through COVID, but I'll talk to you more about these timelines in a second with specific focus on anaesthetic gases. And just to give you a bit of data, so anaesthetic gases, as I say, are responsible for about 5% of the entire carbon footprint of the NHS, which is a huge chunk of a single piece of modifiable factors. And that in turn is around half of all of gas emissions from NHS buildings and estates, so including electricity and power generation, etc. Desflurane is the culprit. I don't know if you can see this little diagram here, but desflurane has the global warming potential of around 3,700 times that of carbon dioxide. So it's a really significant and impactful gas. Using desflurane for an hour is equivalent to a maximum of around 500 miles in a car. So a really significant carbon footprint from this gas, which probably in the vast majority of cases doesn't need to be used any longer. There are significant and probably cheaper as well alternatives which are less impactful to the environment, one of which is sevoflurane, which is probably a much more commonly used anesthetic gas. There don't appear to be, and I'm not an anaesthetist, I'm a gastroenterologist by training, but through significant extensive discussions with colleagues, there don't appear to be any clinical or relevant clinical reasons not to switch. The implications of switching can be really significant. Average size anaesthetic department can save hundreds of tons of carbon dioxide per year, which is really significant when you think about the overall footprint of the NHS. It's about communicating that. How do we empower units who are willing, even knowledgeable about the impact of what they're doing? How do we empower them to make these changes? One of the important ones I'll share with you, which is mentioned in the toolkit, which I'll draw on in a second, is this idea. And this is one of the most sort of common arguments that we come across, if that's the right word. These are comparing two anaesthetists, Chris and Kathy, for no reason other than these are the names that were chosen by colleagues in Newcastle. So Chris is not vegan. He eats a steak. He drives a car to work. He flies across the Atlantic. He doesn't recycle his stuff, but he uses sevoflurane when he comes to work. And Kathy, by comparison, is vegan. She doesn't travel. She doesn't use a car. She never flies. She always recycles everything, but uses desflurane when she comes to work. And so by doing so, she's negated, unfortunately, everything that she's done in her lifestyle. Which is not to say that people shouldn't adopt these greener lifestyle choices. They absolutely should, of course, and we're promoting that alongside. But it's just to highlight the relative impact of the choices that we make in healthcare, and the relative therefore benefit that we can achieve by making even relatively small changes in our practices through healthcare. So that's the other emphasis, the other stress that I want to just reiterate is about really embedding sustainability in every single thing that we consider that we do in our NHS. And what we're trying to achieve with the Anaesthetic Gases project is by September of this year, we'd like every trust in London to achieve or at least have a written plan to achieve a target of less than 10% of desflurane use by volume. We'll be monitoring that through the pharmacy database, the business intelligence arm of the pharmacy database. So prescribing these gases are ordered like anything else, and we'll be able to monitor that. But by the deadline of March 2022, which is chiming in with the national deadlines for Greener NHS programme, we'd like all trusts to be achieving that target and maintaining it. Desflurane is not the only impactful anaesthetic gas. Nitrous oxide is the next one, but that's the next phase of the project. This anaesthetic gases toolkit is designed really to get the ball rolling, so to speak, and to achieve a desflurane reduction in a way that's acceptable and maintainable, acceptable to the vast majority of clinicians. What we're not doing is restricting people's use or removing autonomy from our anaesthetic colleagues, but we're just giving them the information so that they can make their own decisions. And we're not asking for desflurane to be completely wiped off the face of the earth. We're still allowing a sort of 10% total volume use, so it's there for people who want it, but by and large, we'd like to move away from using this really impactful gas. This is where we were across London. This was the data for the whole of 19 to 20, so partly through partly through COVID, but what you could see is that there were about it wasn't a bad state, but this was the old target of 80%, so 20% or less of desflurane use. That target's now up to 10%. But you could see that sort of 11 or so, perhaps more trusts across London were not meeting that target. So significant amount of work to do. So I'm really pleased to show that the figures for May of this year showing that now so far we've only got 4 trusts who are breaching that limit. Sadly, one of which is King's, but we're on target, which is my home base. But we're on target, and my anaesthetic colleagues at King's doing fantastic work to achieve that. So how have we done that? Well, we've developed a toolkit for reduction for departments that want some more information or not sure where to start. This is a step-by-step guide based very much on the audit cycle and was developed by anaesthetic colleagues with myself at GSDT. It's very much based on the research and the comms that has come out of the Royal College of Anaesthetists and the Association of Anaesthetists. So very much talks the right language. And again, it's not about removing autonomy or restricting use of a clinically appropriate anaesthetic gas, but where it's possible to reduce it, we're very definitely encouraging it. The toolkit itself comes as a PDF which you can click through. It's very straightforward, and it has this sort of pyramid structure of processes and practices that can be adopted. There's a pre-intervention questionnaire and a post-intervention questionnaire to monitor progress, and that's very much designed on the basis of real-world sort of shop floor experience from other departments in London and indeed around the country. There's case studies in there. There's data to support the choices that people make and the sort of commonly encountered FAQs or arguments that people will put up when asked to make a change to their clinical practice. If anyone wants the toolkit, then please just email us london.sustainability@nhs.net, and we'll be happily put that out to you. There's also a project that's being run through the Pan London Anaesthetic Clinical Leadership Group, and so colleagues there are sort of also banging the drum for us and with us. So I'm hoping that we'll be able to make significant and lasting changes to desflurane use and thereby significantly impact the carbon footprint of what we're already doing. But also, it's not just about desflurane. Nitrous oxide, as I mentioned, is a significantly impactful anaesthetic gas, not just used in the context of operations. In fact, most of it's used elsewhere, but we would like to focus on that next. So my ask to everyone else is that if you're aware of nitrous oxide projects that are going on in your patch, or any new projects or principles or indeed technology that's being mooted, then please do let us know. We'd also like to share that information with you. Thanks very much.